Besides you, the patient, doctors day in and day out have a first-hand view of what ails our healthcare system. What do they think is the best solution to fix the system? What do they think has been the impact of the healthcare law? And what will happen if it gets struck down? Joining us is Dr. Lee Van Oker, an emergency room physician, and Dr. Ernest Patti, senior attending physician of emergency medicine at St. Barnabas Hospital in the Bronx. First to you, Dr. Van Oker, I'm curious, what has been the impact so far, the limited implementation of this healthcare law to you?
Well, I mean, they've started to do some of the Medicare reimbursement and payback, but there's a problem with Medicare. There's going to be a problem either way with this law because they're going to add a bunch of Medicaid patients to it. We already have a problem with Medicaid. 30% of doctors in this country don't take Medicaid, so the ER is the only place that they can come. And then what's happening is a lot of states right now are trying to stop their access to emergency care. So whether they strike it down or not, they're going to have to account for the problem with Medicaid right now and what's going to happen when more Medicaid patients come into the fold as they expand.
Dr. Patti, two questions to you. What is sort of the impact to you as a doctor? And doctors are also patients, so I imagine you can also give me some viewpoint how you're going to be a patient whether you like it or not sooner or later. Is how you think it'll impact the patients.
Yes, we've all been patients, and let's face it, we need reform. Reform is needed because the current recipe that we have is not working. What I'm happy about, though, is they managed to keep the prudent layperson standard there, which basically lets us allow our patients to come in and still be seen for emergency care. We can't put the onus on the patient to sit there and say, oh, that chest pain I have is just a bum stomach or some indigestion. That was something that really concerned me as an emergency physician. I don't want my patients self-diagnosing themselves. I want them to come in and be seen by a competent physician and be treated for their emergency conditions.
Dr. Van Oker, do you have a sense that this is the right direction or a good idea for doctors and also for patients? And I'll ask the same question. You're going to be a patient whether you like it or not sooner or later anyway. We all are. Or is this, is this healthcare law, has it been, or is it too early to tell whether it's good or bad or indifferent?
Well, I think it's a little early to tell, but the truth of the matter is whether we need a reform or not, just giving people insurance coverage doesn't guarantee them access to care. And the ER is always the safety net that's there picking up the slack.
Dr. Patti, if you could do anything with health care, what would be your program if you could define it and set one up?
Well, we have a lot of things that we have to work on. We have to work on medical liability reform. We have to also address other issues such as the synthetic drugs that are now appearing in greater quantities on the street. We have to also make sure that we take care of and make certain that we don't have drug shortages. I don't know if you're aware, but the U.S. has been suffering from critical drug shortages for the past few years, and they seem to be getting more and more common every day.
I realize we need reform. Everybody agrees on reform. Are we on the right track with this national health care law, or would you like to sort of scrap it and go to a different model?
I would say we definitely need to keep the dialogue going and keep going forward. I don't think we need to scrap anything. I mean, everybody needs to be at the table and work, ahead to further this. But remember, there's going to be different recipes for different parts of the country.
Dr. Van Oker, this current health care law of the president that is in effect right now, scrap it and start all over and do a different model, or what?
Well, I think also agree with Dr. Patti, but there are parts of it that maybe should be scrapped because it's too complicated, it's too onerous. People aren't sure what's going to happen. I mean, Moody's is already reporting, rating changes related to what's going to happen if the bill goes up and down and how it's going to affect industry. But I think there's some basic important things, and we need to make sure there are enough primary care doctors that can see patients. We need to make sure if you get insurance coverage, that there will be a place you can go. Can't prevent people from going to the ER because of their final diagnosis, their indigestion. Chest pain was indigestion, not a heart attack. And but it's a slippery slope, and it's a very tough issue to tackle with one bill.
Thank you both, doctors. Thank you very much. And straight ahead, the attorneys general leading the charge. They're here.